You don't want to miss this next story.
Healthcare continues to be one of the biggest expenses that we incur in this country. Universal Community Health Center is striving to make sure that quality and accessible medical care is available to anyone, regardless of their ability to pay.
My name is Dr. Edgar Chavez, and I am the CEO at Universal Community Health Center. Universal Community Health Center is a health center in South LA that has been around for about 10 years. And our mission is to serve the communities around South Central LA in providing quality, competent medical care.
UCHC is a federally qualified health center, which allows it to provide very comprehensive services while offering a sliding fee scale.
An FQHC is a federally qualified community clinic that gets grant funding from the federal government to provide care to underserved communities in areas where there aren't very many medical services for these underserved communities. The main difference between an FQHC and a regular clinic is that an FQHC cannot turn a patient away for inability to pay for medical services. In addition, an FQHC tries to provide whole person medical care to the community rather than emergency or urgent care, which is what a lot of the community clinics do. UCHC became an FQHC 10 years ago in order to be able to get government funding in order to provide more services like behavioral health, dental care, and other supportive services that we wouldn't be able to do if we were a private clinic.
Unfortunately, all healthcare facilities are not created equal. And sometimes, the simple fact of where you live can affect the quality of services you have access to. As a community clinic in an underserved community, what are some of the challenges that you face?
Many people think that FQHCs, which are federally qualified healthcare centers that get grant funded from the federal government, are free clinics. And people associate free clinics with places being dirty, not providing good services. But in fact, an FQHC, if it's in your community, gets pretty good grant funding to provide excellent care to the community, and there is auditing that happens to make sure that that care actually happens. Universal Community Health Center prides itself in providing culturally competent care, which means that we bring in providers, doctors, nurses that actually speak the language of the community and know the culture, and then provide medical care from within that context. In its approach to providing whole person care, Universal Community Health Center is designated as a patient-centered medical home, or PCMH, which means that we adhere to very stringent guidelines as to how we provide that care, how we measure the progress of that care, and how we treat the community from a whole person perspective.
What does the future hold for Universal Community Health Center?
We are developing a medical assistant program that will allow us to involve the community in providing care in the future. This program will allow us to market to the community and seek out individuals that would like to become part of our community health center and train them to be the next generation of providers. Understanding the needs of the community, Universal Community Health Center is expanding, and we're actually creating a true patient medical home where we will provide medical care, dental care, behavioral health, and other enabling services for the community to make sure that the community has competent healthcare available all the time.
So if you or someone you know are in need of any of the services we've discussed, let the caring people at Universal Community Health be your next stop on the road to emotional health and wellness.
This is especially important for at-risk communities while healthcare is not available all the time.
For more information about Universal Community Health Center, visit their website at uchcla.org. And of course, visit our website at thebalancingact.com.